A Brazilian expat with suspected lupus who solved her butterfly rash and joint pain in just 6 weeks. That's the story of my latest client to solve autoimmune disease resembling lupus, all naturally using the mind-gut immunity method. She has lots of valuable information to share, so stick around. Hi there, I'm Dr. Chanu Dasari, a surgeon who specializes in reversing gut microbiome dysfunction and autoimmune inflammation. My technique for reversing symptoms in as little as 6 weeks has helped thousands of patients over the years and is called the mind-gut immunity method. And if you would like to learn more, visit mgiclinic.com and request a discovery call. Now in this upcoming video, you'll meet one of my Brazilian clients who recently emigrated to the United States. She experienced joint pain, rash, and terrible bloating and constipation. It turns out that constipation was causing bacterial overgrowth and gut microbiome dysfunction, which was the root cause of many autoimmune conditions, including lupus. We were able to solve her issues by addressing the root causes and reverse her symptoms in a short time. So let's get started. Okay, how are we doing?
I'm good. How about you?
Good. Well, thanks for coming on here. I know you're feeling pretty good since when we first started working with one another. I had a couple questions, and we're just getting an update. I wanted to know sort of what symptoms, what changes have you noticed? What positive changes have you noticed since joining the MGI program?
Well, the big change in my life that I can running,
Yeah.
and I did the legacy for 5K.
Oh, good. That's great.
Yeah, in 25 minutes. Was the big change in my life,
Yeah.
especially because I had a lot of joint pain,
Hmm.
and right now I cannot feel anything, especially my knees.
Joint pain is gone, and then the rash, you had like this sort
Yeah,
of
rashes.
yeah, there's like butterfly rash on the face, right? That's
Hmm.
gone now.
No rashes anymore.
Yeah. That's great. So so all of those symptoms are gone, right? The joint pain totally gone,
Yeah.
the rash is totally gone,
Hmm.
and
Bowel movements I can have a daily.
oh yeah, daily
I don't
bowel
need you to
movements.
do, yeah. I can,
That was a
yeah.
problem.
I
That was a big problem.
remember,
The constipation was a big problem with, I
yeah.
remember. Yeah. So that's good. So those were some of the benefits, and you're running 5K. Have you noticed your endurance has improved and your energy level and strength has improved also?
Well, I can tell you my energy improved a lot.
Yeah.
I know I have another things, especially in my periods. I don't have an energy enough, but I can tell after I change, I have a energy.
Yeah, and I know you have a couple other diagnoses that you're dealing with that have nothing to do with this process, but yeah, it's important to know kind of where we are with things. At least you're able to run a 5K and increase your, and you work with a trainer, right? That's what I loved
Right.
about you when we first when we first discussed with one another. You're like, I already have a trainer, I already have a nutrition. I was like, this is great. You have a nutritionist and a trainer. This is wonderful, you know?
It's because I'm trying to different ways before I'm trying to do some surgeries or use
Yeah.
some medications, I believe we can help ourselves with food, with diet and change,
Mhm.
or habits. I don't know. It's just how I think, and because of this, I found you because I
Mhm.
was, looking for different treatments for lupus and in YouTube, and I found you.
That's great. Yeah, I know they do things differently in Brazil. One of the things I noticed was when we first talked, you're like, "Hey, I got a doctor in Brazil." I was like, "Oh." And I was like, how do you contact your doctor?" And you're like, "Oh no, I just text him. He's like my family friend. He's my friend, you know. We stick with one doctor my whole lifetime."
Mhm.
So I talked to him. I've got actually a couple of Brazilian friends. So I called them. I said, "Hey, is this like a thing?" He's like, yeah. In Brazil, when the doctor is like your basically your friend for life, it just
Mhm.
that's how it is, right? So
Yeah.
I know he was really excited to know that, these problems were fixed and solved, right?
Yeah, it's funny because you are the first person that I can see in US. It's more close to Brazilian doctors.
Yeah.
I have a good relationship with them,
Hmm.
and I'm still communicating with them.
Yeah.
And when I need or when I feel struggle with something, normally I text you and I text them at the same time because I know each of you one have a different opinions.
Okay.
And this is about my life. It's no, I will give to you the decisions about 100 about everything. I have to stay, around and see what is better for me.
Yeah.
But I like it because all the time your opinion and his opinion, it's
Yeah.
match. And I say, okay, maybe
Yeah.
sounds good for me.
Yeah. I know. And so the funny thing was, I was like, I do that for all of my patients already. So I was like, I guess maybe like I am closer to a Brazilian doctor in some ways, right?
Yeah,
Yeah. Because the
for sure.
American system, we
Yeah.
have a different system here. You know that, right? Yeah.
Yeah, the American system for me, it's more hard to understand, especially because it's everything through the insurance.
Hmm.
Like I feeling that the insurance has more power the doctor's opinion. You know what I mean? Like I
Like
have
if
to
you need
do
a test,
couple
like you were
labs.
saying,
Yeah, I have to do a couple labs. For my doctor in Brazil and for you, I have to do it in 6 weeks. For my primary doctor, I don't have a reason enough for to do in 6 weeks,
well,
and they
then
ask me for
the
to do
insurance
maybe
restrict
twice a year.
the insurance restricts you from getting the labs or getting the tests that you need in a timely fashion, right? Yeah,
Hmm.
that's a challenge, I think. And that's a the reason it's so challenging is because it's not the way we like to practice. You know that, right? Like we don't like to
Hmm.
wait all this long time. We don't like to have all these barriers to care, but it just seems like it prevents people from having meaningful interactions with their physicians. I
Hmm.
think that's a big thing.
Yeah, but normally we justify, well, we just looking for some help when we have a something,
Hmm.
we never know. But if you have a something severe and you want to change your life, you start to looking for something different.
Yeah. How did you, I know you had spoken to other physicians or seen other doctors before you found me. What were they saying about your condition? Were they just kind of shrugging their shoulders, say we can't help you or nothing to do, or what happened?
The first of all, they try to use a lot of medication,
Mm-hmm.
and I get a reaction, I will say reaction after the COVID booster.
Mm-hmm.
And when I try to see the doctors, they say, well, we don't have too much for to do. And they give to me a lot of steroids.
Mm-hmm.
And I just, I was feeling terrible. And I say, I want to die
Mm-hmm.
because this is crazy for me. I get a lot of rashes in my body. I get pain.
Mm-hmm.
I was so swelling. I gain a lot of pounds.
Mm-hmm.
And I say, this is not for me. It's something wrong's going on in my body and nobody can find. And I told you, each single doctor that I saw, I told them this was after the booster vaccine. And they say, no, it probably not. And I say, well, I have an autoimmune disease as well. You don't think it's something happening in my immunity system? They say, no, and they shock me because I say, I know my body,
Yeah.
you
Yeah.
know?
The immune reaction is when you have autoimmune disease, any kind of inflammation is a problem, right? It's a problem when you
Hmm.
have inflammation. And yeah, I think and what would you say, like, obviously when we started working together, we're texting each other multiple times a day, where you're texting with Mariah, you're texting with Virginia, you got all these meetings to do. We're doing a lot of stuff, right? That first month is very busy. But what would you say is like the most helpful, what was the most helpful thing, because we do diet, we do digestion, sleep, stress, exercise, we redo all the supplements and we're giving you constant support. What would you say was the most helpful thing?
Well, I think when you have somebody that you can text and ask some question, it's more helpful
Yeah.
through in the
That you don't
entry
have to wait or
process.
like get an answer like, well, later on, when it's
Yeah, but I'm saying like when I go to the grocery shop,
grocery.
I want to buy something. Well, when I read the label, for me, it's wow, it's the amazing product. For me, it's free to buy.
Yeah, yeah.
But I'm saying, when I send to you and you say no because of this substance,
Yeah.
and like it's something fructose or something like that, some
Yeah.
sugar, from fruits or whatever. But I said, oh my gosh, for me,
Mhm.
I can buy,
You
a
know,
lot of this.
people don't believe me when I say this, but when I tell people this, I'm like, this program is so specific that even at the grocery store, when you're taking a photo of a label and you text it to us, you get an answer, which is crazy, right? Like, who
Hmm.
does that with their with their health team? It's nobody does that, right? So that's
Yeah.
how granular, how specific we try to help people in real time and try to get answers. So
Hmm. Well, I think in the first month, like you said, it's more busy because we have to text a lot, especially because we don't know, we learn.
mhm.
But after 3 months, I think I can walk by
Yeah,
myself,
you got the hang of
I
it.
just can't, no, I don't want
You
to
already
do this.
know. Yeah, exactly.
Yeah.
Yeah, you already know. You already know. Good. Okay, good. I was gonna say, so now that you're recovered from that issue, what are you looking forward to the most? I know you're making some changes in 2024, 2025. You're really paying attention to your health and things like that. What are you looking forward to the most, would you say?
Well, I don't have a big goals, but if I'm staying in the same weight and still gain some muscles
Hmm.
and have a good life that I have right now, I'm glad with that.
Yeah. And last question, what advice would you give to somebody who suspects they might have autoimmune disease, maybe lupus, okay? And they're having all these weird, unexplained symptoms. What advice would you give to them?
Well, the first thing that I can tell them is don't trust 100% in doctors. Trust in your feelings.
Mm-hmm.
If you feel something's not right, go and find somebody that you can talk and can understand you. You know, after that, you can figure out the best treatment or the best way that you can have, to get a better life.
Mm-hmm. I think that is important, right? Like sometimes we don't listen. I mean, some people they know something's wrong, but then
Mhm.
they don't, and I agree. I think
Get
sometimes
attention for the body.
yeah, we ignore our bodies. I think
Mhm.
that's a big problem, Our body's
Mhm.
telling us something and we ignore it, or we're
Yeah.
doing something because someone says, "Oh, this is the right thing to do," but we don't actually like analyze or do a deep dive into it. I think that is a
Mhm.
problem. I agree. I
It
agree.
is.
Well, thanks. I really appreciate you doing this. I think your story will inspire so many people, and yeah, I'm looking forward to this year and your upcoming, like all the great things that you're going to be doing, right? Hopefully having a baby
Thank you so
soon.
much for everything. Thank you so much for everything. You absolutely changed my life.
Yeah. Thank you. I appreciate it. So I hope you enjoyed this segment. And if you like my content, don't forget to like and subscribe. If you think this video will help someone you know, be sure to repost a link to this video. And as always, I'm Dr. Chanu Dasari with the Mind Gut Immunity Clinic. And let me know if I can help you out.